Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to Be Your Own Hero. I am a stage 4 cancer patient with prostate, bone, and lung cancer, and we're just coming off the Memorial Day weekend, and our weather here in Southern California is phenomenal. It is really, really beautiful, and I'm so excited here today to do this interview with just an incredible person, and her name is Juanita Prada. And so, what I'd like to do is to cut to the chase. I don't really have any health updates other than the fact that met with my oncologist late last week, and she said things are going really well, and I don't have to come see her for 3 months. So that kind of tells me that we're on the right track. so that's so that's a good thing. So at this time, I'd like to introduce everyone to, uh, and she's on the East Coast, Juanita Prada. And Juanita, please introduce yourself and tell us a little bit about yourself and share your beautiful poem.
Yes, my name is Juanita Prada. Like Mark said, I'm in the East Coast. I'm excited to be here with Mark. And a little bit about me. I had childhood cancer, and I'll tell you more about that as we go. But I wanted to start out with a poem that I wrote when I was in college. And I think this is a good picture of what a child goes through when they get diagnosed with childhood cancer. Everybody's story is different. This is my story. 10 years old, first day of 5th grade. I can tell the story countless times and it will never fade. The mild leg pain as I awake for a new day, assuming it's a growth spurt, telling myself it will go away. Forcing a smile as I got on the bus, waving bye to my parents, trying not to fuss. There are 6 hours in a school day. That day, I could only handle 3. And if you had a fever of 112, I think you would agree. Clinic after clinic, vital signs after vital signs, get it tested like a lab rat under all these guidelines. New people, new faces, everywhere I went. I didn't expect a minor leg pain to get to this extent. Arrived to the ER, everything was a blur, thinking why, oh why, did this have to occur? Sitting alone, empty room, fluorescent lights, 10 years old, I had no say, I had no rights. Patiently waiting and waiting for results, wishing I heard an answer from these dang adults. She opened the door, no sign of mom and dad. I knew this white lab coat lady was going to say something bad. Sat next to me, her hand rubbing my back, took a deep breath, and looked at my eyes, receiving the most dreadful news and refusing to hear these rotten lies. 10 years old, I have so much to live for, so much to do. Unfortunately, this nasty illness was not just the flu. Days went by, weeks went by, months went by, a year went by, suffering emotionally, physically, spiritually, and mentally. I am ready to say goodbye. Countless wires attached to my body, adults thinking I am made of steel. Drug after drug, pill after pill, shot after shot, it was all surreal. Steroids, spinal taps, EEGs, MRIs, blood transfusions, radiation, chemotherapy, seizures, stroke, and a state of coma for a month. Well, you get the main conclusion. Didn't think I would live to see the day when I got out of this depression. People were amazed by my courage, my attitude, and my day by day progression. 10 years old, I did 10 years old. I did not ask for all this. Sometimes I wonder what would have happened if my life had just been plain bliss. I try not to ask questions. God always has a proposition. I gradually came to realize going through cancer was part of my mission. From this brutal, traumatizing experience, I am the person I am today. I am a 2-time childhood cancer survivor who has learned to value life, to not take things for granted, and to live day by day.
That is beautiful. I love that. And that's a great way to kick off this interview because there was so much in there. So my first question for you is, what did you first recall when you were diagnosed with cancer? What was going through your mind? I know it was hard for you to process.
Yeah, so the first time, because this happened twice, but it kind of all goes down a timeline together. The first time I recall, just as the beginning, it was like I mentioned, the first day of fifth grade, everything was happening so fast. The symptoms were like I had a big leg pain, I had bruising on me, just random bruising. I got sick really easily. Everything was, it didn't really match up. So we were all kind of confused at the beginning. I recall going to the nurse, having that fever, high fever, and this was not normal. My dad was out of the country. His brother had passed at the time, so he was out of the country visiting the funeral. And then quickly, my stepmom had to quickly call him, let him know, like, hey, you need to come. Juanita is not feeling so well. We're at various doctors. We're visiting various doctors. So I recall just, feeling just panicked and not knowing what was happening. I mean, I was so young, and then afterwards, my dad was back. We went into the hematology oncology outpatient clinic. And as the poem states, I remember I was sitting there, I was looking at the strangers around me, I was looking at the scary environment. I didn't trust anybody besides my parents. I was very scared. And I recall just when the white lab coat lady, literally, she came to say something bad, and she looked at my eyes, and I just was like, she said, she like patted me and she said, Juanita, you have cancer. And I was just destroyed. I just, at that age, I do have a concept that cancer is deadly. And I did have a concept of that I'm going to be bald. And at that age, I was just worried about what my friends were going to think of me. Like I wasn't even worried about dying. I was more worried of like, what will others think of me? I'm that weird child. I was, I just didn't. I was very mad. I was very anxious because again, I didn't know what was this going to be. They started telling me kind of a little by little everything that was going to be happening, that I wasn't going to be going to school anymore, and that just broke my heart. I was very, very scared. I recall when I was one day, I like my hair was falling out in clumps, and that being one of the most traumatic moments of my life. Everything I recall, yeah, I recall just being very, very scared, not knowing what was happening, and why. I think we always ask that question, even at a young age, right? This could start at a young age. Why me? Why not little Jimmy next door? Which obviously was selfish of me to think that way, but I was a kid, right? So I didn't really, I didn't. Why not the bully at school? Just thinking this way. Why, out of all these 100 children in the classroom or at my school, why me? And so a lot of confusion, a lot of, at the time, it's not like I was spiritual or religious, but I did believe in, I do, I believed in God then, I believe in God now. And I was just very like, I did question God, like, why, so a lot of confusion, a lot of confusion, a lot of fear. I could see in my parents' eyes, in my stepmom's eyes, in my father's eyes, and my brothers, my whole family, my mom, just, and yeah, those are kind of what I can tell you right now, what I can recall from those moments of when everything started happening.
What kind of cancer did you have, and what how did they proceed with your treatment?
Yeah, so I had acute, what's called pre-B cell acute lymphoblastic leukemia. It is very common in children, and this is a cancer of the blood and bone marrow that affects the white blood cells, and which we know help us fight infection. It was like a crowding of these blood cells, and yeah, and I couldn't be around people. It was kind of like the COVID era back then. Like I just couldn't be around anybody. Everybody had to wash their hands before coming in. And it just destroyed me in the sense of the initial diagnosis when I started getting treatment. So I'll get into that now. When I started getting treatment, obviously you have to get a portacath or a port or a catheter, but there's many words for it. And that procedure went, it doesn't usually go this way for many people, but you get that golden ticket. That's like, you're going to be the one, just like the cancer card. And for me, it went completely wrong. They cut a vein they weren't supposed to. I had a bacterial infection with it. That first, what's called induction, the first phase of the treatment, it went completely wrong. This led to, going back to the poem, this led to me being in the ICU for a month.
Wow.
Literally a game of, is Juanita going to survive? Because I was totally, I mean, I was in the critical condition in the ICU. And nobody ever intended for this to happen. But things happen. There's always that risk when you have a procedure. And I was in there for a month. I did not, I mean, I can't even tell you, Mark. I'm a miracle. It really is. It is something that um, there was a lot of people around me that they're like, oh, again, that's when we think about the medical aspect of it versus the spiritual part of it, right? Or whatever you want to call it, whatever your God, anything, good luck, anything that you want to call it. Like, I remember just having the people who are like, this is medically impossible for her to get out of that coma. And then you have other people that are like, you know, we just need to keep praying. We need to keep praying. This is going to be all right. Like, keep that faith, keep that hope. And there were, I had that team of people who prayed and prayed and prayed for me. One of them, my family, my mom, she came also, and we're Catholic, so we worship a lot of the Virgin Mary and pray a rosary. My whole family is Hispanic, so they're big on praying the rosary and praying. And we were all just waiting. And then suddenly, miraculously, I came out of that coma. I When I was undergoing that, I did, like I always tell people, like there was something that I did see, like a light. I remember, like I do remember, like a light of something. And it was probably me just waking up out of the state of coma, but it got to a point where my dad had to call my mom at the time and said, hey, you need to come. Juanita is going to die. And that's what the doctors are saying. And this is what's going to happen. And so, but you never know. You never know. There's always that possibility, and there's always that faith and hope that each individual has, that in the situation, you just never know. So that's why I always tell people, maintain hope, maintain faith, and just maintain positive. And so then, like, I came out of that state of coma. This state of coma caused me to get a stroke afterwards. So I woke up having a stroke, is what I can understand and recall. I could not talk. I could not walk. I could not move. I could not eat. I could not write. I could not do any of my activities of daily living. My brain was it went back in time. My brain was of a 4-year-old when I was a 10-year-old. All these things that I just could not do. I could not tell time, nothing, right? We're talking about everything that you're supposed to know at the age of 10. I had to, I couldn't use the restroom on my own. I had diapers. It was a year in the hospital of recuperation, rehabilitation, occupational therapy, physical therapy. There's so many types of therapy, and I got all of them. And it really took a village. That's why I always say the hospital is my second family. And I do appreciate every single person that took care of me, because just from the littlest things. And I remember my dad just like being so proud of me when I took my first walk, like if I was an infant again, just like, and being able, when I woke up out of the state of coma, I didn't know who the people around me were. That took time too. I didn't know who my brother, I speak two languages. I could not, I had to relearn that again. And it's all again a miracle because it was learned, and little by little, like I said, it was a year. And so that happened. And then during that time, I was getting, at the same time, they had to, of course, do the portacath procedure. So that happened. And then doing it again, obviously it was scary, but it had to happen to get my treatment. I got my treatment, chemotherapy, and blood transfusions at the time. And then a year, 2 years went by. I was said to be cancer free. And again, a lot of recuperation in the first round. The second round, I was back in school. And I remember now I was around 13 years old. I was back in school and I turned around. So I was said to be cancer free. I was cancer free in 2006. Then a few months later in 2006, I was sitting in my classroom. I was turning because a girl called my name, and then I just couldn't see from this eye. I couldn't at all. And I got worried, and I knew this was going to get my parents worried. So being a little teenage rebellious, I was like, I don't want to tell anybody because this is going to be like a big thing, that I don't want to even like deal with. Unfortunately, it got to the point that I just couldn't see at all, because I could see a little bit at the beginning, but then I just couldn't see it all. And I did say something to my dad, and right away, my dad's always like, let's go, you tell me everything. So then we went to the hospital, bam, the cancer came back. And this time it was what's called a isolated CNS relapse, central nervous system relapse. And it was like, and then they said that I had a tumor in my eye. And that's where it was like a relapse of the acute lymphoblastic leukemia, which doesn't happen. Again, it doesn't happen to anybody, but just me, so it was just like, wow, this is crazy, and then towards there, now they're like, well, we're going to need to do radiation and chemotherapy to tackle that. So that was more treatment. At that time, I was more mature about it. I knew the people, I knew the places, I knew the faces, I knew where everything at the hospital was. I was like the queen of going up and down the hallway with my IV pole, like saying hi to everybody, very friendly. So that wasn't much of a scared anymore. I knew what cancer is. I knew, you know what I mean? So I started, that was the kind of like the difference, and the mentality that came with like, well, this really sucks. Like, and I'm not going to use ugly language here, but you know what I mean? Like, this really, life sucks. Why me again? It's not like I wasn't like, oh, great, cancer. No, I was mad. I was mad just when I got back and doing things, just when I was back and like being with my friends, just when I missed a bunch of school and I need to recuperate on all that school. I couldn't, it hit me. And so for me, I was really mad. I was really just angry at the fact that like, why this again? Like, I thought, I had a big party that I was done and everything. And now it came back, and it came back at a time where I'm now an adolescent and going through all this stuff that being an adolescent sucks. So anyways, I had to deal with that. But I deal with it with like, okay, I know what to do. I'm going to go in there. I'm going to get the chemo. I'm going to see these people, and I'm going to go back to school, So that was kind of the mentality I had, like, okay, let's do this. So, of course it was difficult. I'm not going to say it was easy. It was difficult knowing that my cancer came back. But what I'm saying is that now it was a little bit less anxiety in the sense of new people and stuff. So then, yeah, that was pretty much like the beginning of the first and second of what kind of started to happen.
Okay, so you're going through all this at a very, very young age. And who did you have to rely on as far as, your confidant, or wh- which people in your life, you know, because cancers can be a very lonely journey if you let it be.
Mhm.
So what did you do as far as the people around you? Who was your main confidant or confidants?
So I couldn't say the main. Actually, yeah, I can. My main confidant was my dad, my father, because he was the most present in my life at that time, and he was with me through the beginning, from to the very end, and he was that parent in the unit that would be on top of each nurse, each doctor at any time of the day, any minute of the day. Like, he would be on top of even like the lab people. Like, he was there just to protect his little baby, and it's not easy also going in through a cancer diagnosis and not knowing the English language. So I always admire my dad for just doing his own research on his own, and asking questions, writing everything down, doing a perfect uh, medical pill box for me of all the pills that I had to take. Just, he was there. I could always, he would stay the night with me, and my dad lost his job like 3 times. People are not compassionate or empathetic. They don't care about you when, I'm sorry, your child has cancer and you can't be here working, then I'm sorry. Some people are, it just depends on the person you're working for. But I do remember, like, he went through so much, and he was watching it all daily, and I could tell, and then, so I would say he was my primary confidant, or, person I go to. And then the rest, it would be, there were so many people, in the sense of, I did have, my stepmom. She was there, especially while I was undergoing weird teenage stuff that, girls go through. And then, like, I wasn't in school to like learn about all that. And so she was there to kind of teach me all this stuff that, the chemo stops a lot of development and growth. And me being in the hospital away from children my age, it didn't, I couldn't ask any questions at all. So she was there for those kind of matters. My mom was always there praying nonstop, and she was just always, when she could be there, she could be there. And my brother and me are so close. He is my older brother, and I mean, it was so hard for him to see it. And he also got bullied at school, or he had his own problems because nobody really was paying attention to him. You know what I mean? And he had to mature quickly too. And then I had, at the time, my little stepbrothers. They were very, close, and a lot of, I had friends when I went back to school that they helped in the sense of, like, I had my nice friends who were understanding, and their parents were nice to like tell them about my situation. And then I had boys at school or girls at school who were just like, man, but the close girls, they were so sweet. My friends, they would do, like, I couldn't go to sleepovers, so they would bring the sleepover to me, in the sense of, like, not big sleepover, but a little sleepover, or I couldn't go to Halloween and do trick-or-treating. So those girls, they put like a Juanita, like, they made shirts that said like Juanita Halloween time, and they all, like, we went trick-or-treating to, like, safe places, like, yeah, I mean, in the sense, like, not too much germs kind of stuff. But they, like, would put everything away to go and help me. And yeah, and anytime I just needed, I'm going off topic now, but basically, like, I had a good team. I had a good support system, and the community was always great. The teachers were great. I mean, shout out to everybody, because I did have a strong community.
That's
They know
awesome.
who they are. So
That's
yeah.
really awesome. Listening to your story and the things that you went through, I marvel at at who you are. And what's amazing to me is, despite all of these awful things, procedures and things that are just, I always looked at them as inhumane because I
Hmm.
always thought, man, how does somebody think of some of this stuff to do to people? It,
Yeah.
it always blew my mind. And I could see where those things, if you let it, can make you very bitter and very negative. But it's a tribute to you, what an amazing attitude that you have, and a
Mhm.
positive, beautiful attitude. How did you acquire that? And how did you, despite going through all this, how did the Juanita of today come about? I am so interested to
Mhm.
hear this.
Mark, it's very interesting because many people always say, "Oh, wow, how you, Juanita, you're so positive. You're so, you're so happy all the time. You're so, yeah." And it's true. Like I do have, I mean, I'm not gonna lie, I have my days where I'm like, wow, why, again, why me? Why at this point? Why, but Mark, it's always something that ever since I was a child, I think that just comes with my personality. I was very always lively, smiley. I always like to make people laugh, and that I kept all that through my cancer diagnosis. I think even before my cancer diagnosis, and then through my cancer diagnosis, then after, I think I just maintained that like attitude of like, hey, it could be worse, right? Like it's a kind of mind shift that goes through my head of like this could be so much worse, and just like, hey, look at it this way. For instance, when I was in school, I had to go into the students with I say special abilities. I don't like to say disabilities. I go into the I had to do a lot of schooling with the children with special abilities classroom, and in there I just remember feeling like, "Ugh, why can I be with my friends who are in the normal classes?" But then I looked around me and I'm like, Juanita, look at the 3 to 4 teachers that you have around you to help you, rather than the one teacher that teaches like those 50 children in the classroom or 30 children. So I think even back then, when I was like in school, I started seeing that mentality in me that, hey, like be grateful that you have all these teacher in here. Be grateful that you're getting the time that you need to finish up at test. Like be grateful of, so it's like that mind shift. Now, when I got into I think the school thing has always been an issue for me, like for many people. I got into community college, and then a lot of the topics that children saw in elementary, middle school, high school, I did not see. I skipped like a huge gap of it, where I went over them, but it was quickly. Um, and so when I got into community college, I didn't understand a lot of the material, for instance, like for like science. And um, the professor, she just didn't understand, and she just looked at me like, it's hard to believe that adults do that too, but she just didn't understand how a person who's like 20, 23 years old is not able to understand the mitochondria, or something like that, and so she failed me in the class because of something like that, and I understand, everybody has to have their points and exams and everything, but it was so hard. It's hard for me as a survivor, especially that cancer affected my cognitive abilities. So it's hard, to just go around and tell everybody like, oh, I can't do that because I can't do that switch, etc. But she failed me, and I was just devastated because I needed that course, because that was for my 4 year degree program, and I was just taking that community class, and I was devastated. I was so mad at her, and I called the university and I told them my cognitive difficulties, and why this happens. And I just, like, I think they should give me an opportunity. Anyways, I went far and beyond to tell the university, like, hey, this is not fair, this is blah blah blah. And then nothing was done about it. So then I just had to like stick with it. And I took biology 3 times for it to like get a little bit get engraved in my head. And it was not easy at all. And I did, and I forever went and like was mad and very resentful with that professor. And then after the time that it took me to kind of stop being resentful, I was like, you know what, Juanita? Like, maybe you had to take that class 3 times to understand the concept, you know? And maybe it was good that you did this because look where you are now and you're able to, So it's a mind shift that really brings me into like, Juanita, maintain positive, because when I passed that class, now it was a B, and I was like, this is awesome. But I also wanted to mention, Mark, that, and please give me a second real quick. When I when I just wrote a little note down and I said, I began to realize every day could be my last. So why not smile, forget the worries, and live in the moment? So I said, I do believe that God healed me for a reason, and that my 2-time childhood cancer experience was a lesson in maintaining hope, trust, and faith. I do believe that my personal experience going through the unimaginable and conquering every little milestone after cancer is because of my optimistic outlook when I am feeling broken down. So my ability to quickly switch my mindset from a negative to a positive is something I am very blessed with, because I think that my attitude became more like that after I survived. Um, so yeah, that's everything that I can say to your question about that. That it's really just a mind shift of like thinking of what could be something worse, and just yeah.
You know, Juanita, we have a lot more to talk about. So what I want to do is I want to invite you back to finish up, because you have so many valuable lessons to share with the world. And I'm anxious to hear the rest of it. But what I'd like to do is wrap up this particular interview and thank you so much for your time and so much for your just honest sharing of your story, which is absolutely fantastic. And so, what I'd like to do is, I'd like to thank everybody for joining us here at To Be Your Own Hero, and appreciate every single day, as Juanita said. Uh, Nobody is guaranteed tomorrow or even later on today. Anything can happen. So we all should take advantage of every single day. Every single day, make the most of it, because you never know when your last day is going to be. We're all going to go at some point. So make the best of every single day, every single hour, every single minute, and every single breath. And let's help to make this world a better place, like Juanita is, and sharing her story. And thank you so much for your time and for your beautiful, beautiful story. Thank you so much. And everybody, have a fantastic week. And we'll join you right back here at the same time, same place, at To Be Your Own Hero.
Thank you,
Thank you so
Mark.
much.